Hi, I'm Kim, a resident doctor with stage 4 sarcoma cancer that's terminal. Get ready with me this morning while I talk about some of the physical changes that I've experienced and how I cope with them. I've already moisturized and put on sunscreen. And as always, I sit while I get ready to help with my shortness of breath. As a reminder, I'm a doctor, not a makeup artist, and so if you like this type of content, my favorite creator is Selena Marchant at Selena Makeup, and I'll tag her in the comments because she influenced a few of my products. I'm certainly no stranger to physical changes associated with a cancer diagnosis. As a lot of you know, I was diagnosed with sarcoma cancer in 2021. At that time, the main physical change that I went through was actually less to do with weight and more to do with my physical body and its capabilities. I originally had a small, palpable lump in my left leg that was about pea-sized, but because it failed chemo and radiation and continued to grow on therapy, after about 6 months of treatment by August, after it was diagnosed in February, I had a football-sized mass on the back of my leg. I had people approach me about this when I'd wear shorts or skirts in the grocery store, saying things like, "Your leg looks bruised," and things like this, when I was clearly bald from chemotherapy. And I am a physician, so I'm biased, but I think it was pretty clear that it was a very large football-sized tumor and not just a bruise on the back of my leg. It was hard sometimes to get approached by strangers about this mass, and even harder once I had the surgery and then had some physical disability associated with it. I was self-conscious about my limb difference, how one leg looked a little bit different than the other. And so I worked with a counselor for this, and I really focused on choosing styles for places where I'd be around strangers who didn't know my story, like looser fitting pants, longer dresses and skirts, where you couldn't actually see the leg, although you could still see my slight gait abnormality or limp. The scars themselves don't really bother me. I don't see them as warrior scars or anything like that, but I'm just not personally bothered by them. I moisturize them often, and I try to minimize their appearance, but I don't do anything special. I have 3 surgical scars from my wedge resections of 3 masses from my original mastectomies, and then of course my primary scar that goes from my buttock to my knee. You specifically commented on weight here. Weight has been something that has fluctuated a lot for me during my cancer treatments, and this is very normal. Something that I think we don't talk about a lot as cancer patients, especially as female cancer patients, is that while there have been protocols that I have lost weight on, such as my first chemo protocol, where I lost almost 60 pounds and was quite emaciated, and that was also a body change that I didn't like, and none of my clothes fit. I've also had times where I've gained weight on treatment because of steroids. And steroids are commonly used to help with nausea and energy during chemotherapy. Most women, 75% in fact, will actually gain weight in their abdomen and elsewhere in their body during treatment for breast cancer. That's not the cancer that I have, but the reason is because of steroids. A lot of people have to fight to get their pre-cancer body back, especially in light of the fatigue and physical changes that come after cancer. This is normal. For me, I really focus on finding clothes that fit my body and not trying to squeeze my body into uncomfortable clothes. For example, today, I was feeling a bit bloated, and so I chose a loose-fitting pant. Feeling comfortable and unrestricted in my clothes helps my breathing, and also helps my self-confidence when I don't feel like I'm squeezed into clothes that don't fit. Of course, a change that you can't go without stating is hair loss. I've had many times where I've lost my hair because I've been on 4 different chemo protocols that have all been associated with alopecia. I coped with this by taking the bull by the horns, so to speak, and cutting off my hair before I lost it and donating it to charity. Knowing that my hair would be used for a wig for children with cancer really helped me cope with that loss. And I've got some great wigs, I'll show them sometime, that I typically wear when I want to feel like more myself. But I currently actually kind of like my white hair change from Lipsopinib. I think it's kind of Targaryen-esque, and you can see my eyelashes are also quite white, as are my eyebrows. So sometimes the changes can be seen as positive or cool, and so I like to try to keep that mentality. Some of you asked what I got at the Sephora yesterday. I got one thing at Sephora. I was influenced again by Selena. This is the Forever Glow Maximizer by Dior, and this was a splurge item that I've saved for over several paychecks. So I'm really excited to try it today. Looks like I'm only going to need a little tiny bit. Here's what it looks like. This little applicator wand. I'm going to use my blush brush. Okay, well, we're gonna need to blend that out. Shoppers Drug Mart also had a sale on, well, not a sale, but at Optimum Points event for makeup, and there were a couple other things I needed to pick up. And if you spent $75, you got I had a coupon for 20,000 Optimum Points worth $20. So I replaced my mascara, it's almost out. I replaced my L'Oreal eyeliner, it's liquid liner, which was almost out. And I'm going to try a new brow product for these brows today from Benefit. It's called Precisely My Brow Detailer. And I also picked up Precisely My Brow Wax. But in short, I think it's pretty normal to go through some worries or wonders about your body during cancer. I think it's a normal human experience to want to look and feel your best. And I think as a society, we really value appearing well as a portion of feeling well. And one of the reasons I get up and try to put on makeup every day, except for when I'm feeling really quite tired or sick, is because I think that the most important person to get ready for is my husband. And I get to see him every day. He doesn't put any pressure on me to look a certain way, and I'm so blessed. But when I think about who am I trying to impress, my handsome hubby is kind of the guy. So I think my message is do things regarding health and beauty for yourself first and foremost. And maybe for the people who you love the very most. But ultimately, it's normal to experience body changes on cancer treatment. A lot of people who recover from their illness will get their body back later, so to speak, should they wish to. And there's lots of supports in the community, like physio and OT to help with function, and of course, lots of resources to help with quote-unquote beauty, but health should always be the priority. And frankly, if anyone has a problem about how you look while you're fighting for your life, that's on them. So I'm sorry that society has put these pressures on women. I'm sorry that you're experiencing these worries and wonders, but I want you to know you're not alone. We're in this together, and I support you during this time. I'm just finishing up this mascara. Okay guys, that's the finished look. Have a great day.